We are the Empowerment Project, and you're listening to La Voz de la Gente. Good morning, Spotify listeners. You're here with Marissa and
Annabelle
on this beautiful Thursday, February 1st morning. So we made it through January. We're here during a Teen Dating Violence Awareness Month. And also there's another awareness month going on in our community, HIV Awareness Month, for a specific communities of color. We're going to go ahead and interview a special guest that we have here from El Paso Public Health. We'll allow them to introduce themselves, give more information, and just stay tuned. All right, so without further ado, Sergio, would you like to introduce yourself?
Hi, yes, good morning. I'm Sergio Flores. I am an HIV Education Outreach Specialist for the City of El Paso's Department of Public Health HIV Prevention Program. I am also an M-Factor Coordinator. M-Factor is essentially a social group for gay, bi, and queer men to meet each other through free social events. We do host free events for the community. Feel free to follow us at mfactor915 for all of our, again, free events and any updates that we might have. And most recently, I have been selected as of October of last year as a CDC ambassador for the Let's Stop HIV Together campaign. And hopefully I can share more information with you today.
Thank you, Sergio, for being here with us. We'll go ahead and get started. We have some questions and details. Sergio has some events that he wants to share. So, Annabelle, you want to go ahead and get started?
Yeah, so my first question is, why is HIV prevention important in the community, especially the importance in the communities of color?
Right, so HIV prevention is extremely important because it is still an ongoing epidemic. It is not what it used to be at the beginning, of course. However, we still are seeing new rates coming up every month. CDC data has been murky ever since COVID, because it did impact all aspects of public health. The most recent complete data is as of 2019, but as of the HIV Prevention Program for the City of El Paso, we did find 22 new cases in our last fiscal year. So we did surpass what we were expecting to find, but it's still, ongoing. We still encourage everybody to know their status, get tested, seek treatment, know about preventative methods, especially because here in El Paso, we're a very Hispanic-focused population, and that is our priority population here in El Paso, particularly Hispanic men who have sex with men, transgender individuals, and most notably Hispanic women. And hopefully we can target those populations, empower them, not only in English, but also in Spanish. That is something that I find very lacking when it comes to HIV education. And, hopefully we can target that.
Yeah. Thank you for sharing that information. A lot of our listeners, I'm sure, aren't aware of what El Paso Health has to offer about M-Factor. So thank you for sharing. How is it preventable? So we talk about HIV, we know about getting tested, but how is it transmitted? How is it preventable?
Right. At this point, HIV is extremely preventable, not only through safe sex practices, safe sex education, but now there's also biomedical interventions. PrEP came into the market a little bit over 10 years at this point. It was hard to educate the public, especially on this new innovative tool. But it is a tool that, if you feel you're at risk, you're welcome to seek that preventative method. It's called PrEP, which stands for pre-exposure prophylaxis. But not only there's PrEP, but there's PEP, which is post-exposure prophylaxis. I'm willing to share where to get it. At HIV Prevention, that's what we talk about, especially since that biomedical intervention is only for people who test HIV negative. Mm-hmm. So as soon as I know they're negative, we can talk about it, their options, where to get it. Essentially, PrEP should be for free in Texas. So I'll give them their options based on whether they have, insurance or not. But aside from the biomedical interventions, we talk about condom usage because, again, let's remember that HIV is a sexually transmitted virus, as well as through, sharing needles, blood transfusions. We get a lot of cases from the plasma center that are reported to us, and, we help these individuals link them to care because not only is HIV preventable, treatment is prevention as well. Mm-hmm. When somebody starts treatment, they're on their way to becoming undetectable, meaning that they can no longer transmit the virus through sexual means. And, they can live a healthy, normal, long life just as everyone. They just have to be conscious of, following up with their provider, constant blood work, make sure they're undetectable, and, they stay on medication.
Definitely.
When we're talking about HIV, who does it affect?
Well, HIV does affect everyone, as we've learned through the COVID epidemic. viruses do not discriminate. However, there are certain, factors that might put you more at risk to an HIV acquisition. That's why we encourage safe-sex practices, condom usage. Again, like I mentioned, the biomedical interventions. The CDC does recommend that everybody 18 to 64 get at least screened for HIV once in their lifetime. But of course, if you have multiple sex partners, maybe you share needles, that screening should be much more often. So it depends on an individual. The questions that we ask for prevention were very, inquisitive as what kind of risk factors you have. So based on those, I like to encourage, come in every month, every 3 months, seek PrEP services and continue those PrEP services, until you feel it's comfortable for you.
Can you explain to us and also our listeners what the difference between HIV and AIDS is?
Right. So HIV is the virus, or HIV stands for Human Immunodeficiency Virus. It is the virus that attacks the immune system, in particularly the CD4 cells. So after a decades long of HIV infection not being addressed, it does develop into AIDS, which is acquired immunodeficiency syndrome. In this country, we should not really be seeing any AIDS cases, considering that once an individual starts ART or antiretroviral therapy, they become undetectable, meaning that their CD4 cell count is normal. They can fight off any viruses or any opportunistic infection, rather, and they can lead normal, healthy lives. So yes, treatment is prevention. We do encourage anybody who thinks they might have been exposed. So just be aware on those signs. But again, if you think you might have been exposed, seek medical advice as soon as possible. Come to prevention, get educated, get screened. And that's just the best route to go to, because again, such as chlamydia, gonorrhea, syphilis, not all of them show symptoms right away.
Yeah. And that goes with the importance of making sure that you are getting tested and taking that initiative of making sure that you are healthy and things like that, because you never know.
Exactly.
Yeah.
Definitely. And if we want to prevent it, that's the main way, right?
Yeah.
Testing. So we primarily cater to a youth population, around high school, college level. But we know that HIV doesn't discriminate. Right? Are there cases where it can affect youth? Where can youth in our community go and get treated if that's something that they're experiencing?
Right. So unfortunately, I have seen cases where as early as 18, I've had to tell somebody they're HIV positive, and I had to link them to care. So again, yes, regardless of what age group you're of, if you're sexually active, if you, don't use the most or even have the knowledge to have these safe sex practices, it's imperative that you, empower yourself with this knowledge. At HIV Prevention, we can test as early as 14 without having to have a parent or guardian. So feel free to stop by. I don't think I've mentioned our address, 701 Montana Avenue. We do test Monday through Fridays, 8 a.m. to 11:30 a.m. and then 1 p.m. to 4:30 p.m. It's a walk-in clinic. You do not need an appointment. All we ask is for a picture ID. And again, all of our services are for free. There's no charge that's accrued. We do offer after hours every third Wednesday of the month, which is 5 p.m. to 8 p.m. So we try to make ourselves as accessible as possible. I personally do outreach a lot, whether it's here at the center or, bar outreach first Friday of the month. But particularly for youth, feel free to stop by. You do not need to be accompanied by anyone.
Going back to that, if a youth would unfortunately test positive, what are the parameters for confidentiality with that?
Right, so all of our testing is confidential. As soon as I identify somebody who does need to be linked to treatment, I do have to ask some more questions, especially when it comes to the subject of insurance, because let's say they are on their parents' insurance. Unfortunately, they will get a letter, I think it's called explanation of benefits. So that might come up. So I let the person know that they don't have to disclose their status to anybody. However, if they are under insurance, the places where I link to do have to go through that means first. If for some reason the insurance doesn't cover everything, they get linked to Ryan White Services, which is a federal program, so anybody living with HIV can, get everything covered. But that is the murky situation. Even in PrEP, if somebody wants to get on PrEP but they don't really want to tell their parents, that is something that will come up, because that will be sent to a letter in the explanation of benefits. So even though they don't have to disclose to anybody their status, I do encourage you have that conversation, because once the insurance get involved, that might be, like an issue. So just have that open conversation so that in case that might happen.
And does that apply to also just within our state of Texas? We know that consent for sexual activity isn't until the age of 17. Are there parameters that, as an organization, y'all have to abide by in order to like report that a youth was having sexual activity if they do come out positive?
Right. The only thing that we need to report is the case.
Okay.
Because there needs to be an investigation done. That's done by the DIS department, the Disease Investigation Specialist.
Okay.
So they will reach out to this individual who tested positive, whether it's HIV, syphilis, who are your partners. You don't have to, go out and tell them directly. We could do that work for you. This is so that we can contain any, spread of whether it's HIV, syphilis, chlamydia, and gonorrhea. So that's the only reporting that we need to do. It's not so concerning like, oh, this person is having sex. It's more like, okay, let's try to contain it so that, there's not these huge cluster of cases, especially in the community. So as for the reporting part, that's the only thing that we report. My priority, is to get him into treatment and starting to getting him undetectable. Or if it's syphilis, getting into the clinic to, get their antibiotics and get that taken care of. But that's what I prioritize, the individual seeking treatment and, knowing that everything's going to be okay.
That's good to know. So that way we have that confidentiality aspect of it clear enough for our youth and our young adults who may be college aged to have a better understanding about the services that they could get in this community.
I feel like we touched base on a lot of stuff. So for your agency, I know there's some events that are coming up. Can you explain what the events are?
Yes, for sure. In February, well, it is Black History Month, of course, but when it comes to the, the HIV field, it is National Black HIV AIDS Awareness Day, which will be on February 7th. This year, the theme is Engage, Educate, Empower, United to End HIV AIDS in Black Communities. February 7th is observed ever since 1999 as this day. So again, going back to the subject of vulnerable populations, unfortunately, African Americans or the Black population is disproportionately affected by HIV. That is a very small percentage of our population, but let's still, put this into consideration, considering that, racism is still something that still impacts not only social issues, but medical care, especially in the field of HIV and AIDS. So let's make sure that we address the issues, especially with this community. In commemoration of this, HIV Prevention will be hosting a movie night. We'll be screening the movie Moonlight, which is a coming-of-age story of this gentleman and throughout different facets of his life. And I do welcome the community to stop by on the 7th at HIV Prevention, 701 Montana Avenue. It'll be from 7 p.m. to 9 p.m. There'll be a brief discussion, and we'll watch the movie.
Sounds good. Thank you for sharing that with us. We'll also go ahead and share this information on our social medias as well, on Instagram. So be sure to see our story, our post about this event. Now, a little bit more personal, right? What encouraged you to get into this type of work?
I take my work very personal because, the biggest group that's affected by HIV and AIDS has historically been gay and bisexual men. And as a person from that community, I've seen firsthand the stigma that still surrounds HIV and this particular topic. So this is a very deeply personal area of expertise, I would say, because, I've seen it affect people firsthand. I unfortunately still see people living with HIV not really have the best quality of life, not only because HIV is still stigmatized. So I take it as a very personal endeavor. I did take it into, my own hands to try to be a beacon of hope. If I don't know if that sounds a little bit too exaggerated, but if anybody comes here to get tested, I want somebody who has been in their shoes,
Yeah.
Growing up as a gay man, I always thought, well, am I going to get this? How do I prevent myself from getting it? And then when PrEP came into the market, it kind of opened my eyes and I saw the possibilities in the future, and it kind of gave me hope. So I personally want to give hope to other individuals who have these questions. That's why I applied to be an ambassador for the CDC's Let's Stop HIV Together campaign. And it's very collaborative. I've met people from different parts of the country. My community partner, he's Puerto Rican. I do encourage you to follow him on social media. He's very uplifting, especially when you need somebody who knows a lot about HIV and AIDS in Spanish. It is often the case that somebody comes to me and I have a session in Spanish, and that's the first time I've ever heard about PrEP. And that is concerning because it's a tool that is, again, it's been around for 10 years.
Yeah.
And for them to be the first time to hear it in Spanish, it's concerning. But that's essentially why I do the work that I do.
Yeah.
I want to empower them with as much knowledge, whether it's in English or in Spanish. And my friend Andres, Monotrapeao on Instagram, he goes live a lot. He teaches you a lot, his journey. So I encourage you to follow not only me, them, but all of my CDC ambassadors. Because ultimately, we do want to...
I feel like maybe you've answered this, but what has been the biggest thing that you've learned in this role?
Well, the fight is ongoing. I've been given the opportunity to go to conferences. In September, I went to the National HIV conference at USCHA in Washington, D.C. So I got to meet a lot of people who are very inspiring to me. Like, let's continue this fight. Let's make sure that people living with HIV have a quality of life. Let's make sure that Ryan White funding is still available. So that's like the biggest thing I've learned. Like, this is ongoing. There's people who are still, fighting for it. We still have community members all over Texas, whether it's the Q in Austin, the Alamo Rainbow Center in San Antonio. There's still a collaborative fight, and that gives me hope. I will post February events later on today. Again, we host our monthly workshop, where we, talk about HIV and AIDS, or generally STI prevention in a safe, fun environment. We try to make it as fun as possible, and we have a social event every month, and it's for free. If anybody is interested in attending our events, just send us a DM. In February, we'll be going rock climbing. So again, just send us a DM if you're interested in coming. We'll be posting that later today.
Is there an age capacity for that, like a for that event?
M Factor targets 18 to 39-year-olds.
Okay.
But anybody's welcome to come. As long as you DM us. I don't want any reservation to go to waste.
Yeah, definitely.
Yeah, so just send us a message, and if there's space, we'll definitely have you.
Sounds good. Well, thank you so much, Sergio, for being here. I know that my questions have been answered to the most extreme, and I really appreciate you sharing information with us. Annabelle, you have anything else to add?
I think that's it. I think it's just, we really appreciate you coming out here and giving this information because, like we all know, sometimes a lot of people are not aware about these things that are going on, and I think it's important for prevention to be educating the community on these important topics. But yeah, I really appreciate you and all the work that you do.
Thank you so much. But if anybody does have a question, whether it's HIV related, STI related, we do have resources to, get free testing. So if you have any other questions, I get MFactor 915. I'll be happy to answer any questions.
And we'll be sure to add the contact information, again, the street address, and the Instagram account. So that way y'all can have that in the description below. And even more on our social media as well. We'll go ahead and we'll tag M Factor. Sergio, do you have anything else for us?
No, again, I welcome the work that you do. It's very empowering, whether it's prevention, violence prevention, HIV prevention, STI prevention. It's all very important.
Definitely. Well, thank you for empowering the community as well.
Thank you.
All right, y'all. Thank you for listening. Stay tuned for our next episode next week.
And we are La Voz de la Gente.